as a clinician, it's important to get a very good appreciation of what that person is aiming for in their life and what are the minimum competencies that they would like to have achieved by the time they leave your room. So that conversation needs to happen obviously with the person with brain injury, but it also needs to include their significant others, so their wife or their husband or their children or their partner or their friends or whoever is in their life. And once you've got some ideas about their goals, it's really then setting about achieving them and creating communicative opportunities for them to be able to achieve goals. And for some people that may be, the main goal might be monitoring their own behaviour and learning how to listen to themselves, both the person with brain injury and the family member, because sometimes we've found that family members really change how they communicate with the person with brain injury after their accident, and they're not always good changes, so they may speak to them in a condescending way or speak very quickly and not let them have a turn or talk for them even. And these are patterns of communication that we've seen frequently, especially with mothers of people with brain injury, but also between husbands and wives. And this can limit the opportunities that are available for that person with brain injury to get their message across. And so it doesn't help them in their recovery, even though what the family member is trying to do is to help. And quite often these behaviours are a way of trying to improve the situation, but they're actually doing the opposite. For family and friends too, it's easy to forget that what they're dealing with on a daily basis is the result of the brain injury. It's not that the person has become a horrible person or that they're suddenly losing their temper all the time and they're difficult, and it's easy to lose sight of the fact that there is a real reason why this person may have challenging behaviour or may seem to be not very sensitive to the person. So I think for families, it's coming back to that point of, and we found that in our training program with families, that we did a whole module on what is a brain injury, what are the effects of the brain injury, and then talking about, well, how did your relative change because of their brain injury, and tying it back to that reason seemed to make it easier to deal with. And so they're not dealing with it on a personal basis, they're dealing with it, I guess, on a more scientific, intellectual basis, that there is a real reason for this. And so these are some strategies I'm going to use to deal with that. And people will say, even though they may have been given that information before, sometimes they need to hear that information over and over and over again. Even 20 years after the injury, it's still sometimes worthwhile revisiting that with them to help them make sense of what they're dealing with. So sometimes creating a safe environment for that person to perhaps watch a video of an interaction of themselves talking to the person with brain injury, that can create a situation where you can then have a talk about that and say, well, is there anything about that we might want to change, and let's think about changing that. So I think they're quite powerful concepts, but if you get them through to the family member and the person with brain injury, and they can become more aware of their communication, then they will change what they're doing.